So breast cancer has a hormonally driven engine in it, so that the female hormones estrogen and progesterone can tend to stimulate the growth of breast cancer cells. That's one of the reasons we've seen that use of postmenopausal estrogen progesterone combinations can sometimes increase the risk of breast cancer. So what we did was, back in the 1970s, they made a drug that is an anti-estrogen, and that drug came out as Tamoxifen. And this drug actually blocks the effects of estrogen in the body. It blocks the effects of estrogen in breast cancer cells. We used it in women who had breast cancer, but we wondered that if women who had a high risk of developing breast cancer would be protected by Tamoxifen. So about 16 years ago, we had a very large study across the United States where we took in about 7,000 women, and half of them we gave Tamoxifen to, and the other half of them we gave a sugar pill to for 5 years. We picked these women out as being high risk based upon a computerized model of their age, when they first started their menstrual periods. It's called a GAIL model, G-A-I-L model. You can actually see it on the internet. There's another one that's called an IBIS cancer tool. So if a woman wanted to go to the internet and enter those two things, she could actually look at her risk after she answered all the questions there. And if she's high risk, she could be a candidate for the Tamoxifen. The reason is because with that study, the women who took the Tamoxifen for 5 years had a 50% reduction in the number of breast cancers they developed while on the Tamoxifen, and it has lasted now for 16 years. We followed these women over and over and over again so that they have a prolonged decreased incidence of breast cancer. So not only did they get help during the 5 years they were taking it, but they got help for over 10 years longer than that. We also still use the drug to treat women who do have breast cancer, okay? But it protects these women who are at high risk. It doesn't do it 100%, but it gets a 50% reduction, which is quite valuable. McLeod was one of the national sites for that study. We put on a number of women through our research department. We then did another study right after that one with another drug called Raloxifene, sort of a sister drug of Tamoxifen, and that was actually found to be beneficial also. So there's a couple of different drugs that are out there. Since those two studies, there's been a number of other studies so now we have 4 drugs available to high-risk women, depending upon whether they're premenopausal or postmenopausal. And it's Tamoxifen, Raloxifene. There's a drug called Arimidex that's been proven to also be useful, and there's a drug called exemestane that has also been proven to be useful. The exemestane trial was in postmenopausal women, and it actually gave them a 68% reduction of their incidence of the cancer developing. We've got a lot of things we can do for that high-risk woman who maybe had a sister who had breast cancer or a mother who had breast cancer, and they should discuss this with their primary care physicians, GYN physicians. These are physicians who know about it, and if there's any question, they can be referred to us oncologists, and we can see them as patients and counsel them on this.